Hello, dear nursing student. You're welcome to Eminence Nursing Academy. And in today's class, we'll be discussing about anatomy and physiology of blood, general knowledge about anatomy and physiology of blood by your dear Mrs. Fakonle, or you can as well call me Nurse Taiwo, whichever one you want. So, in today's lecture, as I've said earlier, we'll be discussing about general knowledge on anatomy and physiology of blood by your dear Eminence Nursing Academy. So in this picture, you can see this is a normal picture of a blood that shows the plasma. You can see the plasma, you can see the erythrocytes, you can see the monocyte, the basophils, the eosinophil, the platelets, and the lymphocytes that comes out from a blood vessel. So this is a sample of a blood vessel. This is a diagram of it, of a blood vessel. And inside it, there is a blood gushing out. So when you just see just your physical eye, you just see a blood, just imagine that these are the components of a blood, and which are the plasma. This is the plasma. Then the lymphocytes, the eosinophils, this is the platelets, and this is the basophils. The basophils, eosinophils, this is the monocytes, they are the white blood cells, and this is the erythrocytes. The erythrocyte is the red blood cell, is the one that have this biconcave shape, and this is the platelets. So let's go to the next slide. Yeah, introduction to blood. We all know what blood is. We've been seeing blood right from the time that we are young. We know what blood is. Maybe when you have a cut, when you have an injury, I see blood coming out, you know what is blood. So I want to tell you that blood is life. Without blood, no one can live, because blood comprises nutrients, many things. In this class, you're going to see the functions of blood, of what blood does to the body. And blood is as simple as a connective tissue. It provides one of the means of communication between the cells of different parts of the body and the external environment. So it's like a means of communication. It takes nutrients from one tissue to the other. It transports it down to the brain, from one organ to the other, from the digestive system to the brain, to the reproductive system, to every part of the body. So blood is like is a means of communication between all these cells and the tissues. Also, let's look at the functions of blood. The oxygen produced from the lungs is being transported by blood. So it transports oxygenated blood from the lungs to the heart, and also it transports the oxygenated blood from the heart to the lungs. So it's part of the function of blood. Another thing is that blood also transports nutrients from the alimentary tract to the tissues, to the cells. You know, when there is metabolism, after metabolism, the food nutrients, it is the blood that transports it to the necessary tissues in the body, to the necessary tissues, to the necessary organs of the body, as well as it is blood that transports waste to the excretory organs, like to the kidney. It is blood that transports all these waste products to the kidney, whereas the kidney will now work on it, and it will now be transported out as a urine out from the body. So it is the help of the blood. So it's also the blood that transports hormones secreted by the endocrine glands to the Attaches glands, and tissue. The hormones secreted by the endocrine glands in the brain, it is the help of this blood that will transport it to the different glands and for an action to take place. So it's by the help of the blood. So the hormones secreted by the endocrine glands to their targeted glands and tissues, I've explained that, and also is the blood, be it produced in our active tissues to the other less active tissues. So it's also the blood that help them, to transport it from active tissues to other less active tissues. Another thing is that it serves as a means of protective substance, e.g. antibodies to areas of infection. For example, the white blood cells are the one that fight against infection. So the white blood cells in the blood are the ones that serve as a means of protective substances. Another functions of blood is that the clotting factors that coagulate blood minimize its loss from ruptured blood vessel. When there is an injury, the blood will gush out. Like for example, when there's a cut of a vein, the blood will gush out, and the help of these clotting factors will be the one to stop the blood, to minimize loss of the ruptured blood vessels, to minimize loss of blood from the ruptured vessel. So it's the act of this clotting factor that help someone to not to lose much blood. So if this clotting factors is absent, they will just be bleeding. So there's nothing to stop it, to act as a something to protect it, and also to stop the blood from gushing out. So still under the introduction, blood makes up to 7% of the body weight. You can imagine that. You can calculate that your body weight and divide it by 7. So it makes up to 7% of body weight. Like that's about 5.6 liters in a 70 kg man. So for a man that weighs 70 kg, the blood in the body is about 5.6 liters. So the proportion is less in women and considerably greater in children. Why is it less in women? You can think about that. The reason why it's less in women is that women do pass out blood every month called menstruation. So this menstruation that is coming out every month will reduce the liters of blood in a woman. So you cannot compare the total blood count of a man and of a woman. It can't be the same. The one of a man is higher. When I mean a man, I'm talking about a normal person, not someone that is sick. A normal woman, a normal person, a normal man, and a normal woman, the total blood volume in a man is usually higher to a woman, because a woman will do menstruation every month, and that will reduce their blood volume. So gradually it decreases until adult level is reached. So blood in the blood vessel is always in motion. Blood is always in motion. It's always moving. It's something that is moving. So if there is a blockage in the blood vessel and it's not allowing the blood to move, it will cause a problem, and that is abnormal. So the blood has to move freely in the blood vessel to different tissues in the body. I mean, to the cells, to the tissues in the arm, to the tissues in the chest, to the tissues in the abdominal cavity, to the tissues in the legs, to the tissues in the feet. The blood has to move freely to all body organs, to the heart, If there is a blockage of blood to the heart, you know what that's caused? It can cause heart attack. These are the things. And if there is a blockage in the coronary artery, it can cause heart attack. It can lead to an heart attack because there is a blockage in it. And if there is a blockage in blood that flows to the brain, it can lead to a brain death. It can lead to a brain death. So these blood vessels have to be free for blood to move. So the continual flow maintains a fairly constant environment for the body cells. Blood volume and the concentration of its many constituents are kept within the narrow limits by homeostatic mechanism. That means it has to move freely. It has to be homeostatic in nature. It has to move freely. Now to the composition of blood. Blood is composed of a straw-colored transparent fluid, plasma, in which different types of cells are suspended. Plasma constitutes about 55% and cells about 45% of the blood volume. The blood constitutes of plasma and blood cells. The plasma is of 55% and the blood cells is of 45% of a blood volume. The blood itself, it consists of a colored transparent fluid. That's why if you get a blood sample and you leave it for a while, there will be let me go to the next slide so you can get it. There will be a flow of a white something colored pale like nature that will flow on top of the blood, whereas the one at the bottom in the container consists of the blood cells. These are the blood clotting. So the blood has already clotted, so that's the blood cells. The one that flows up is the plasma. So you can see in this diagram, this is a blood sample collected so this one that flow is the plasma, and the plasma consists of water, protein, and electrolytes. So the one down here, the blood clotted, is the blood cells. These are the red blood cells. These are the and also the eosinophils and the neutrophils. And the one at the middle, the tiny one at the middle, is just like 1%. And it may not be visible to eye. It may or it may not be visible to eye, just like 1%. You can see that it's tiny. These are the platelets, the peripheral blood mononuclear cells. And the platelet consists of the lymphocytes and the monocytes, whereas the red blood cell consists of the eosinophil and neutrophils. But the plasma consists of the highest part of a blood sample of a blood. You can see that it's 55%. And out of the 55%, we have water, we have protein, and we have electrolytes. Now let's take it one after the other. We're going to discuss about plasma, then we discuss about the platelets, then we discuss about the red blood cell. So firstly, the plasma, this constitutes the constituents of a plasma are water, which is 90 to 92% of it, and dissolved substance, including plasma protein, which are the albumins, globulins, including antibodies, e.g. fibrinogen and clotting factors. We have plasma, and the plasma consists of water and some plasma proteins. And the water in the plasma is about 90 to 92%. And we can see that the plasma protein here are albumins, globulins. These are the likely questions that you may be asked in the exam. They may list the plasma proteins for you, and they will ask you to pick which one that is not part of a plasma protein. So it can be in any of MCQ, anatomy and physiology blood exam. So another thing that consists of plasma is inorganic salts, which are the sodium chloride, sodium carbonate, potassium, magnesium, phosphate, iron, calcium, copper, iodine, and cobalt. Another nutrient is also that it consists of nutrients principally from digested food, e.g., monosaccharides, mainly their glucose, amino acid, fatty acid, glycerols, and vitamin. Now, plasma, still under the plasma, we have organic waste material, e.g., urea, uric acid, and creatinine. If a woman is pregnant and they suspect eclampsia, and they will say, okay, let's get the blood sample. They may get the blood sample. They want to see. They may get the urine of that woman as a sample to check for creatinine, to check for urea. So normally urea should be in the blood, not in urine. So if there is presence of urea in urine in a pregnant woman, that means they have to suspect that woman for eclampsia. So another thing that consists of plasma is hormones. There are some hormones that may be present in it, and enzymes also. Enzymes, e.g., certain clotting factors. Also, another thing is gases, e.g., oxygen, carbon dioxide, and nitrogen. So, in an hospital, when a blood sample is being collected and is being taken to the lab are going to check out for some things to rule out a disease diagnosis. So, these are the reason why they are taking blood sample, because they know that blood sample consists of some body nutrients, body hormones, body enzymes that they can use to detect if there is any abnormality. Plasma proteins. The plasma proteins, which makes about 70% of plasma, are normally retained within the blood because they are too big to escape through the capillaries pores into the tissues. They are largely responsible for creating the osmotic pressure of blood, normally 25 mH, which keeps plasma fluid within the circulation. They are largely responsible for creating the osmotic pressure of blood, which keeps plasma fluid within the circulation. You can see that this plasma protein, they are big, and they are too big to escape through the capillary pores of the tissues, but their responsibility is to make the osmotic pressure to be normal, and this keep the plasma fluid within the circulation. Another thing is that the plasma protein levels fall. If the plasma protein level fall because of either reduced production or loss of blood vessels, osmotic pressure is also reduced, and fluid volume into the tissues, that's oedema and body cavity too, will reduce. These are the functions of this plasma protein. Like if there is an injury or there is a bleeding, and instead of all these bloods to be gushing out where the injuries happen, is the function of this plasma protein that will be reducing the blood volume, so that there will be enough blood to sustain the body. So that's why when there is too much bleeding, you will see that the person will either faint or go into osmotic shock. The person can go into shock because there is reduction in the blood volume, and there is not enough blood to the blood tissues and cells. So that's why in such case that person may just faint, or go into coma because there is reduction in blood volume. Now to albumins. Albumins are formed in the liver. They are the most abundant plasma protein, and their main function is to maintain a normal plasma osmotic pressure. Albumins also act as a carrier molecules for lipids and steroid hormones. These albumins also work like the one that we spoke about, like the globulins, but in these albumins, they maintain a normal plasma osmotic pressure. This one happens whether there is an injury, whether there is a bleeding or not. It maintains the plasma osmotic pressure so that there will not be too much blood flow into the body tissues and cells, and also there will not be shortage. Even though a person is anemic, the albumins will still try to maintain the normal blood flow to all tissues in the body. And also it acts as a carrier of molecules for lipids and steroid hormones. Globulins are formed in the liver and the remainder in lymphoid tissues. Their main functions are as antibodies, that is immunoglobulins, which are complex protein produced by the lymphocytes that play an important part in immunity. They bind to and neutralize foreign material, antigens, such as microorganisms. They bind to it. Another thing is that transportation of some hormones and mineral salts, e.g. triglobulins, carries the hormone trioxin, and transferrin carries the mineral ion. That's another function of globulins. They transport some hormones and mineral salts. Another function is that they inhibit of globulin is that inhibition of some proteolytic enzymes, e.g. microglobulins inhibit trypsin activity. They inhibit some proteolytic enzymes. So now let's discuss about the clotting factor. The clotting factor are substances essential for coagulation of blood. They are the substance essential for coagulation of blood, so that when there is a bleeding, it is the clotting factors that will make the blood to coagulate, to reduce the bleeding, to reduce blood loss. So serum is plasma from which clotting factors are being removed. You know, we've discussed about plasma. So now if you want to know serum, there's something called serum. Serum is minus plasma. A plasma consists of a clotting factors, but when the clotting factors are being removed, when it has been removed, and then it is called serum. So let's discuss about fibrinogen. This is synthesized in the liver and is essential for blood coagulation. Fibrinogen is synthesized in the liver and is essential for blood coagulation. Plasma viscosity, that's thick, that is the thickness of blood, is due to plasma protein. When you see a blood, some will say this blood is very thick. It is due to the plasma protein, that's mainly the albumin and the fibrinogen. That means the percentage of them in a blood that is visible to your eye, that you see that is very thick. The thing that makes the blood to be thick is the albumin and the fibrinogen. So the viscosity is used as a measure of body response to some diseases. Now to the mineral salt. Inorganic salts, that's also called the mineral salts, are involved in a wide variety of activities, including cell formation, contractions of muscles, transmission of nerve impulses, formation of secretions, and maintenance of balance between acid and alkaline. So in health, the blood is slightly alkaline, and the alkalinity and acidity are expressed in terms of pH. That's pH, they will set the pH level or pH measures. So which is a measure of hydrogen ion concentration. The pH of blood is maintained between 7.35 and 7.45 by an ongoing complicated series of chemical activities involving buffering system. Nutrient foods. I said that blood also consists of some nutrient foods. So the nutrient food is digested from the alimentary tract, and the resultant nutrients are absorbed, e.g. the monosaccharides, that's mainly from glucose, amino acid, that's mainly from the protein, fatty acid, glycerol, and vitamins. So together with mineral salts, they are required by all body cells. All our body cells too requires it. So the rice that you've eaten, when the rice digested, from glucose is also digested into a minute element called monosaccharides, and the monosaccharides is then being transported by the blood into the body tissues. That's when it will make your skin to glow. For example, they said if you take orange, carrot, your skin will glow. So it is the blood that transports the carrots, the orange, the food, the nice food, the balanced diet you've eaten. So it is the digested food will be transported by the blood towards the necessary body organs that needs the nutrients. So together with mineral salts, they are required by all body cells to provide energy, because the body cells needs glucose for energy. They need protein to grow. They need fatty acid. They need vitamins. So it is blood that transports it to them to provide energy, to provide heat, to provide strength. So, and also materials for repair and replacement. For repair and replacement, that is from the protein you've taken, to amino acid, to repair and replace tissue damage and all that. And for the synthesis of other blood components and body secretions. Organic waste products, that's under the functions of blood. Urea, creatinine, and uric acid are the waste products of protein metabolism. So they are formed in the liver and are conveyed in the blood to the kidneys to excrete it. Don't forget, when you take a proteinous food, it's being digested, it's being metabolized, digested, and it is blood that will transport it to the liver. So all this organic waste is now then being transported from the liver then to the kidney by what? By blood. It is blood that will convey it to the liver, and from the liver to the kidney. By the time you eat a food and it's being digested, it's being metabolized in your small intestine, then it is blood that will now transport it to the liver. When blood transports it to the liver, all the waste products that have been digested in your body, in the blood, the liver will take it out. When the liver take it out, then it will now be conveyed in the blood to the kidney for excretion. So it is the kidney that excreted all these waste products, which will now come out as a urine. It will come out as a urine. The water that you drink will not just come out as a urine just like that. It will mix with blood, increase the blood volume. That's why in plasma, water consists of 90 to 95% of it. So the water will increase the blood volume, mix with the blood volume, transport the nutrients, the other things, the hormones and all that, to necessary organs, then now transport it to the kidney. So it is now kidney that will now excrete it out, that will come out as urine, as a byproduct, as a waste product, with other products, for example, like with urea, with I said with urea, with potassium, with sodium, and all that, as a urine out from the body. So carbon dioxide released by all cells is conveyed to the lung for excretion. That is the carbon dioxide that is released by all the body cells in the body will be released. You breathe in oxygen, you breathe out carbon dioxide. Where is the carbon dioxide coming? It's coming out from all the cells in your body, because the cells are working. As they are working, they are releasing, they are taking in oxygen, they are releasing the carbon dioxide. So it is the help of the blood that will convey the carbon dioxide, to the blood, to the lungs, and the lungs will give it, will change it, will process it, and the blood will now transport it from the lungs back to the heart, and there will be exchange like that. So it will be rotating, the exchange, there will be rotation back again to the lungs, then back again to the blood. So when the carbon dioxide goes to the lungs, it will be excreted out through the way you breathe out. You release the carbon dioxide. When you breathe in, you breathe in oxygen. The oxygen goes to the lungs, meets with the blood coming from the lungs as carbon dioxide. There will be exchange there, exchange of carbon dioxide and oxygen. The carbon dioxide will go out from the lungs. The oxygen will go into the lungs, mix with the blood in the lungs, then back to the heart. Then the heart will now push it out to the necessary organs in the body system. Now to the hormones. These are the chemical compounds synthesized by the endocrine glands in the brain. So hormones pass directly from the cells to the glands into the blood, which transports them to their target tissues and organs elsewhere in the body, where they are being influenced cellular activities. For example, let me use this example of when an hormone is released from the endocrine glands to the uterus every month. That's the release of progesterone, estrogen, and all that to a woman. It will release that hormone that is a certain time of this month that you are a menstruation have to come, because fertilization is not taking place in the uterus. Then there have to be shedding of the inner lining of the uterus. That's when menstruation comes up. But it is the help of blood that will transport the hormones being released by the brain to the uterus to shed blood. That's when that will happen. So that's why I said blood communicates the body organs to each other. So without the help of blood, uterus cannot just shed out the inner lining, because a hormone has to be released, and it has to pass through blood to uterus. Do you get that example? Now, gases like oxygen, I've explained this earlier. Oxygen, carbon dioxide, and nitrogen are transported around the body in solution in plasma. So oxygen and carbon dioxide are also transported in combination with hemoglobin in red blood cells. Red blood cells moves with oxygen and also with carbon dioxide, and they are being exchanged in the lungs, as I've explained earlier. Most oxygen is carried in combination with hemoglobin, and most carbon dioxide as bicarbonate ions dissolved in plasma. Atmospheric nitrogen enters the body in the same way as other gases is present in plasma, but it has no physiological functions. It has no physiological function. That is just a normal thing. So now to the cellular blood content. We've discussed about the function, we discussed about blood and the functions of blood. Now we want to go into blood cells. There are three types of blood cells. We have the erythrocytes, we have the thrombocytes, and we have the leukocytes. Because when you see a blood, they are component of it. So the types of blood cells, the erythrocyte, the thrombocyte, and the leukocyte. So the erythrocytes is usually called red blood cells. The thrombocytes are usually called the platelets. The leukocytes are also called the white blood cells. So all blood cells originate from the pluripotent stem cells and go through the several developmental stages before entering the blood. All these blood cells, they are being originated from a pluripotent stem cells. They won't just come up just like that. They are being originated from a cells too in the body. So different types of blood cells follow separate lines of development. So blood cells will also develop, but their development differs. The development of red blood cells, platelets, and white blood cells differs. They differ. So the process of blood cells formation is called hemopoiesis. Hemopoiesis is the formation of a blood cells. Hemopoiesis, this is it, hemopoiesis. Hemopoiesis. Trying to circle that so you can. So when you hear hemopoiesis, it means formation of a blood cells. The process of blood cells formation is called the hemopoiesis and takes place within the red bone marrow. It takes place in the bone, at the bone marrow of a bone, at the red bone marrow of a bone. That's when hemopoiesis takes place. That's where the blood cells form. Hemopoiesis. So cellular blood content, continuation of the cellular blood content. For the first few years of life, red bone marrow occupies the entire body capacity, and over the next 20 years is gradually replaced by fatty yellow marrow that has no erythropoietic function. So in adults, erythropoiesis is confined to flat bones. So at adults, erythropoiesis occurs in another part of the bones, not the red bone marrow. It will not be by the fatty yellow marrow of the bones. So in adults, erythropoiesis is confined to flat bones, irregular bones, and the ends, that is epiphysis of long bones. That's when you hear epiphysis, it means towards the end, toward the edge of a long bones. That's where these blood cells formed in adults. But in the first few years of life, before 20, it usually occurs at the red bone marrow. So the main sites being at the sternum, the ribs, the pelvis, and the skulls. Let me take that again. In adults, erythropoiesis is confined to flat bones, irregular bones, and that's at the end of the long bones. So the main sites being the sternum, the ribs, the pelvis, and the skull. These are the flat bones that in adults, formation of bone cells do occurs there at the yellow marrow of the bones, not at the red bone marrow again. So now the first blood cells that we're going to discuss is the red blood cells. So Red blood cell is also called the erythrocyte. Wherever you say erythrocyte, just have it at the back of your mind that that's the red blood cells. So usually they are circular but concave, and they are non-nucleated disc. They are non-nuclear. They are not nucleated. Excuse me. They are circular but concave non-nucleated disc with a diameter of about 7 microns. They are circular. So measurement of red blood cells numbers, volume, and hemoglobin content are routine and usually assessments made in clinical practice. They usually measure it when they take a blood sample. They want to know the amount of red blood cells that you have. And that's why these are the things, these lab tests are the things that make diagnosis to be very easy for a doctor to know. And for example, if someone is sick and the person is pale, the person appear pale, and the person is sick, they want to know the amount of the red blood cells that is in the blood. So when they take a blood sample, they'll check the amount, the level, the measurement of the red blood cells. They want to know. So now they can say the erythrocyte count. They want to know the erythrocyte count, and the erythrocyte count is the number of the erythrocyte per liter or per cubic millimeter of blood. When they take a sample, they want to know the erythrocyte count that is in it. So the packed cell volume or hematocrit level, this is the volume of red blood cell in 1 liter or 1 millimeter of the whole blood. They want to know the packed cell volume or the hematocrit of that is in a blood sample or in a volume of a red cell. So when you heard about the erythrocyte count, the packed cell volume, just know that they want to know the amount of red blood cell in a blood sample. Maybe they're suspecting anemia, and this also helps in diagnosing for sickle cell. Those people with sickle cell disorder, they want to know the amount of red blood cells they have, because usually in a sickle cell, their red blood cell used to be in S shape instead of it used to be concave. It used to be S shape. So when they view it in a microscopic lens, it will be S shape instead of concave shape. So all that also makes a doctor to diagnose someone for sickle cell anemia. So this is a diagram of a red blood cell that is circular in nature and is concave and is non-nucleated. So the erythrocytes, the mean volume, they may want to check for the mean volume. This one I'm explaining now is for the MLS students, but as a nursing student, you have to know you have to have the idea of the blood sample results, because when a blood sample is being tested in the lab, the result will be sent to the nursing station. So by the time you see the result, you should be able to read it and have the idea of what is happening in your patients. So they may write like mean cell volume. This is the average volume of a cells measured in femtoliters. Usually when the blood sample result is out, they are going to write the normal range and the range that your patient fall into it. Because as a nursing student, I'm not expecting you to know the normal range for all samples, for all blood samples, but at least you should have the idea. When you see a test result, you should have the idea. You should be able to interpret what the test result is saying. That's the reason why you are taking anatomy and physiology. You should be able to interpret it and work towards it, and also it will help you in your own nursing diagnosis and assessment and nursing process on what to do. Because already if you see a blood sample results that comes out and shows that the normal range for the erythrocyte is low, or the total blood volume of your patient is low, and you've already see the normal range, and you see the one of your own patient that it is low, you should suspect that this patient is anemic. There are some patients that they may not be pale, but they are anemic. And in your nursing process, you will know what to do for your nursing process, how you're going to take care of that patient that is anemic in nature. And that's when you're going to talk about the nutrients. Your nursing diagnosis, your care plan is going to talk about the nutrients that this patient is eating. That's when the dietary plan will come up, and it now depends on the level of the anemic. If the patient's if the patient's blood volume is very low, that it's warrant the patient to take blood transfusion, that is another case. That is another case that you're going to treat in your care plan. But if it is just something that is not too much, that with nutrients or some prescription, that's prescription of some multivitamins, can help this patient to balance back the blood erythrocyte that is low to be within the normal range. Then you know how to go about that in your care plan and nursing process. Hope you understand that. So the mean cells volume, this is the average volume of cells measured in femtoliters. So the hemoglobin is the weight of, this is the weight of the hemoglobin in whole blood, measured in grams per 100 ml. Mean cell hemoglobin, this is the average amount of hemoglobin in each cell, measured in picograms. The mean cell hemoglobin concentration, they want to know that this is the amount of hemoglobin in 100 ml of red cells. All this is for you as a nursing student to just have the idea of a test result, of a blood sample result when it's out. Now, development and lifespan of erythrocytes. As I said, that in the earlier stage of life, erythrocytes and other blood cells are formed at the red bone marrow. So at the later stage of life, it is formed at the yellow bone marrow of the flat bones. Have that, don't forget that. Let that be at the back of your mind, at the flat bone. But in the early stage of life, it's at the red bone marrow, where the red bone marrow, that's the, for example, like the femur, the red bone marrow in there is being formed before 20 years of life. Then in adult, after 20 years, like that, then it's being formed at the yellow bone marrow. So that's where the formation of red blood cells are. Now, I want to discuss about the development and the lifespan of erythrocytes. Yes, blood cells too also have lifespan. As they develop, they die. They develop, they die. So they have the lifespans like that. Now, erythrocytes are formed in red bone marrow, which is present in the ends of long bones. You already know your long bones. For example, the humerus, the femur. And in the flat and irregular bones, they are also formed at the flat and irregular bones. For example, the flat bone can be pelvic bone, it can be skull, they are flat bones. It can be scapula, they are also flat bones, and also irregular bones like the ribs, they are also formed there. So they pass through several stages of development before entering the blood. So their lifespan in the circulation is about 120 days. The lifespan of a red blood cells in the body, as they are flowing from one tissue to the other, when their lifespan comes, they die off. And before they die off, another red blood cell is being produced and is being released out. So their lifespan in the circulation is about 120 days. So the process of development of red blood cells from pluripotent stem cells takes about 7 days. About 7 days, another blood cells have been produced and it has been released into the circulation. So when it's released into the circulation for about 120 days, it dies. So before that, another one is being released like that, and it's called erythropoiesis. I've explained erythropoiesis, that erythropoiesis is the formation of blood cells. So it is characterized by two main features, that's maturation of the cells, formation of hemoglobin inside the cell. The cell is going to mature, and also in the cell there will also be formation of hemoglobin. Hemoglobin is very, very important. That's why when you see a blood tonic, they'll write hemoglobin there. That's the iron. Hemoglobin is very important. So maturation of cells and also formation of hemoglobin in the cell. So maturation of cells. During the process, the cell decreases in size and loses its nucleus. Don't forget, red blood cells is non-nucleated, is non-nuclear. It doesn't have any nucleus in it. But when it is forming, during the process as it is forming, the cell decreases in size and loses its nucleus. These changes depend on a number of factors, especially the presence of vitamin B12 and folic acid. These are present in sufficient quantity in a normal diet containing dairy products, meats, and green vegetables. These are the food nutrients that you eat that will enrich your blood cells. That's the dairy products, the meats, the green vegetables. They will enrich your blood cells. And again, I forgot to say something. During the lifespan of red blood cells, and their lifespan usually is 120 days, I have said. But for sickle cell anemia, for sickle cell patient, or for sickle cell person, or a person with sickle cell, their red blood cells lifespan is not up to 120 days. Yeah, it's not up to 120 days. So in that case, they need to be forming more red blood cells. Their bones has to be forming more red blood cells, which makes their long bones to overwork. By the time it's overwork themselves, because this our body is just like a communication. By the time it's the lifespan of the red blood cell is not up to 120 and they die off, the body will be asking for more red blood cells in the circulation. Meanwhile, I need to be making the red bone marrow to produce more, and as they are producing more, they are dying. They are not getting to their normal time before they die. So I want to discuss that too, about the sickle cell patients. Another thing is that for sickle cell patients, their red blood cell is not bioconcave. It is S-shaped, and because it's S-shaped, the movement, there won't be flow of this blood in the blood vessel. The flow of the blood will be reduced, and because of the S shape, they won't be able to flow. So the S shape will now be, because they are slow, they will now be locked. As they are locked, they will be locked at the bones. That's the reason most people with sickle cell do complain about bone pain. They complain about pains in their bone. It's as a result of the lodge of the S-shaped red blood cells in their bones that is causing the pain. So let's move ahead. So if the diet contain more than is needed, they are stored in the liver. if you are eating more than what your body is needed, there is a way body normalize things. That's why if you are taking water, if it is excess, there is a way the body will normalize it. So if it is then when the body can't normalize it, then that is when abnormality will happen, will occur. So on a norm, that's why if you see this dietitian, they will tell you the amount of food to eat in a day. I mean the amount of egg to eat as an adult, of beef, of vegetables, of fruits. So if you eat all these things in excess, there's a way it will be stored. So if the diet contain more than is needed, they are going to be stored in the liver. So in maybe, for example, in a day and you are not eating enough food or enough nutrients, the nutrients being stored in the liver will now be released into the blood system to flow into the tissues and the cells of the body. Hope you understand what I mean by that. For example, when a person is on fasting, maybe you are fasting now and you are not eating, the diet that you've eaten, the food you've eaten before, the nutrient that is in the food, it is being stored in the liver. Some of it is being stored in the liver. There are some food that you've eaten in excess that is being stored in the liver. It's the liver that stores it. So when you are now on dieting or you are on fasting, so you're on fasting and you see that you still have that strength to go to work. You are not eating from morning till evening. You still have that strength to do some things. If you are still using that energy, where do you think that energy is coming from? It's coming from the excess glucose. It's coming from the glucose that the liver have already stored for you. It's coming from the protein that you've taken that it has already stored in store for you. So when you are not eating anything, and normally the blood is waiting in your small intestine to take some nutrients to the blood tissues, and it's not receiving anything from morning till afternoon till evening. So will the body now shut down? No, it will not shut down. The liver will release some of these nutrients into the bloodstream, and the blood will now take them to the body. This is how they work. Even when we are sleeping, our body is working. They are communicating. Even when you are sleeping, they work. They are working. They are communicating. When you are sleeping. So when you are not eating, the liver release this nutrients into the blood, and the blood will now take it to the necessary tissues. Then when you now feel weak, when you feel weak that you can't do anything, that means the body is trying to tell you that you don't have more glucose. You need to take glucose, you need to eat. But at least the remaining in you, the body is still managing it. That's when it will instigate hunger. That's when you will be feeling hungry, that you have to eat something, because you have to eat something for absorption to take place and for blood to take some nutrients to the necessary tissues. Hope you understand. So absorption of vitamins like vitamin B12 depends on the glycoprotein called intrinsic factor secreted by the parental cells in the gastric glands. That's for the absorption of vitamin B12. There is a glycoprotein called intrinsic factors, and this is secreted by the parental cells in the gastric glands. So together they form the intrinsic factor vitamin B complex. During its passage through the intestine, the bound vitamins is protected from the enzymatic digestion and is absorbed in the terminal ileum. So the effect of deficient intake of vitamin B12 do not appear for several years because they are largely stored in the liver, just as what I have said. They are largely stored in the liver. These are the functions. If you go and read the functions of the liver, you will see this there, that the liver stores some food nutrients, and part of it is the vitamin B12 that I just explained here. Then for folic acid is absorbed in the duodenum and the jejunum, where it undergoes change before entering into the blood vessel. Signs of deficiency are apparently within a few months. You see, for someone to be deficient of all these vitamins, of all these food nutrients, it doesn't occur in a day. It doesn't occur in a week. It will occur after few months. Because if you are fasting, but at least you are still breaking your fast in the evening, you are still taking something, you are still eating. So from that morning to evening, you've not eaten any food. So what's the nutrient that your body is working on, that is making you to walk, that is making you to sleep, that is making you to stand? It is the stored vitamins, the stored nutrients in the liver. So when in the evening that you now eat, the nutrients that enters your body, like the nutrient, the metabolism, after the metabolism and absorption, those nutrients will go back to the liver. There's a way this our body works, the body mechanism. There's a way it works, that it stores things for future purpose. So deficiency of either vitamin B12 or folic acid leads to impaired red cells production. You see, because liver have to keep some vitamins for red bone marrow to produce red cell. If the liver is not keeping some vitamins, is not keeping some nutrients, and normally as our body is being created in the body mechanism, the red bone marrow has to create red cells, has to produce red cells every 7 days. And you now decide to fast. So with the red cell shut down, that we are not producing with the red bone marrow shut down, that we are not producing red cell because the owner of the body refused to eat. But because when you are eating, the liver is storing some nutrients like the vitamin B12, the folic acid, is storing it for the red bone marrow to use it to produce cells production. Hope you understand. Now, the formation of hemoglobin. Hemoglobin is a complex protein consisting of globin and an ion-containing substance called Heme. That's iron, which is very important, and is synthesized inside developing erythrocytes in red bone marrow. Hemoglobin in mature erythrocytes combines with oxygen to form oxyhemoglobin. And that is why when you see an erythrocyte, you have to see oxygen, because they work together. It moves with them. Erythrocyte consists of some gases, and the gas is oxygen. It moves with oxygen. So when oxygen mixes with it forms oxyhemoglobin. That's in the lungs. Don't forget, the blood goes to the lungs to get oxygen and to release carbon dioxide out. It goes to the lungs. So hemoglobin in mature erythrocytes combines with oxygen to form oxyhemoglobin, giving arterial blood its characteristic red color. It is the oxyhemoglobin that gives the arterial blood its red color. That's why when you see how am I going to describe this? When you see when you see a red blood that is very reddish in nature, you know that it consists of oxyhemoglobin. But when you see some blood sample, or any blood that is not that reddish, that wants to look like bluish in color or dark red, then you know that the blood sample is not with oxygen. When you see a blood sample that is that is dark red. It doesn't have oxygen in it. But the one with oxygen, that is oxyhemoglobin, erythrocyte, is usually red, bright red. So in this way, the bulk of oxygen absorbed from the lungs is transported around the body to maintain a continuous oxygen supply to the cells. I've explained this earlier. So hemoglobin is also involved, which is the iron. Very, very important. It's also involved. Iron is very, very important to your body cells to a lesser extent. And in the transport of carbon dioxide from the body cells to the lungs for excretion. That's how it works. I've explained this earlier, that there will be transport of carbon dioxide from the body cells, from the body tissues, through the blood to the lungs for excretion. Then they'll pick the oxygen and they will transport it. The blood will transport the oxygen to the heart. Then the heart will now push it out to the body system. And we're going to discuss more about that in the cardiovascular system. So I will explain more about it. But for now, just have the knowledge of how the body works. Because if you don't have the knowledge of blood, the functions, the cells, then when I'm explaining cardiovascular system to you, when I'm explaining how the heart pump blood to the body system, how it goes to the tissues, you'll be able to understand. So blood is like a foundation for cardiovascular system. So each hemoglobin molecules contain 4 atoms of iron, and each atom can carry 1 molecule of oxygen. I believe you've done atoms, elements, you've done that in your 100 level. You've done that in your chemistry, your physics, and others. You've done atom, ions, you've done elements, because I know that I've been measuring some elements, and so you not get confused. So you can get that knowledge from, you already have that knowledge from 100 level anyway. So each hemoglobin molecules contain 4 atoms of iron, and each atom can carry 1 molecule of oxygen. Therefore, 1 hemoglobin molecule can carry up to 4 molecules of oxygen. Hemoglobin is said to be saturated when all its available binding sites for oxygen are filled. When the binding sites for the oxygen, when they are filled, then it is saturated. So when oxygen level are low, only partial saturation is possible. There won't be enough saturation. So it's not only that when you are in a place and you can't breathe very well because there's not enough oxygen. It's not only you that you are feeling it. Your blood cells too, the erythrocytes, is also feeling it, because the erythrocyte is not gaining more oxygen for more saturation. So you can see that these are body, they work and they connect with themselves. So control of erythropoiesis. I've said that the erythropoiesis is the formation of blood cells, and the formation of blood cells, how does it control it so that there won't be too much of red blood cells in the blood vessels? The control of it is that the number of red blood cells remain fairly constant. The body already knows the number of red blood cells that it has to produce every 7 days. It already knows. So which means that the bone marrow produce erythrocytes at the rate at which they are destroyed. So that's how the body works. That is the mechanism. The rate at which they are destroyed is the way at which they produce. I explained that in the case of a sickle cell patient. In a case, someone that is sickle cell, the red blood cell is S-shaped. So they die easily. They are not bioconcave. They die easily. And apart from that, they die easily. They don't have enough strength to live up to 120 days. So they die around that 70 days. They die around that from 40, 70, 60, 80 days. They are not up to 100, they are not up to 120 days. So they die. So as they are dying, according to body mechanism, they have to produce more. So it's giving stress to the red bone marrow to produce more more blood cells. It's giving stress to them. But in a normal person, the body already knows that it's for 120 days, and before the 120 days lapse, it already produced another blood cells. So their formation depends on how it depends on how at which they are destroyed. So this is due to a hemostatic negative feedback mechanism. That means there is a mechanism. It's just like directly proportional to at which they are produced is directly proportional to at which they are destroyed. So the primary stimulus to increase the erythropoiesis is hypoxia, and that's the oxygen. When there is not oxygen, when a person is not breathing in enough oxygen, maybe the person is in an environment, a closed doors, that there is no oxygen to breathe in for the blood, for the erythrocytes to connect with oxygen to form hemoglobin. When there is not this oxygen there, then there will be hemolysis. That means the red cells will be damaged. They will be destroyed because they do not have oxygen to bind with and to work. Because without this oxygen, they can't move. There won't be saturation. There won't be blood saturation in the blood vessels. So the primary stimulus is increased erythropoiesis, and is hypoxia, that is deficient oxygen supply to the blood cells. This occurs when the oxygen carrying power of blood is reduced by, e.g., either hemorrhage. When there is hemorrhage, so hemorrhage is another example. When there is bleeding means hemorrhage means bleeding. When there is bleeding and there is no stoppage of this bleeding, and the blood cells, they are dying, because at that point the red bone marrow can't or quickly produce red blood cells. So there will be hemolysis or excess erythrocyte breakdown. The excess erythrocyte breakdown is the hemolysis due to disease. Some disease too also can cause hemolysis. For example, cancer. That's the best example I can give you. So the oxygen tension in the air is reduced as at high altitude. When the oxygen tension in the air is reduced as at high altitude, then the blood cells, they are not grabbing any oxygen. They are not forming any hemoglobin. So there will be breakdown of blood cells. So hypoxia increases erythrocyte formation by stimulating the production of hormone, hormone erythropoietin. Erythropoietin, when there is not oxygen, that's hypoxia, absence of oxygen in the blood. That's hypoxia. That's what is called hypoxia. And it increases erythrocytes formation by stimulating the production of hormone called erythropoietin, mainly by the kidneys. Erythropoietin is produced by the kidney. It's an hormone produced by the kidneys. So when this erythropoietin is produced, the erythropoietin stimulates an increase in the production of pro-erythroblasts and the release of increased number of reticulocytes into the blood. They form a mechanism. Erythropoietin stimulates increase in production of pro-erythroblasts, and erythroblasts will now say, okay, reticulocytes, be released into the blood. When that is being released into the blood, this will now increase the oxygen carrying capacity of the blood and reverse tissue hypoxia. It reverses it because the body really needs oxygen, But what are the other way that the body can use as a defense mechanism before oxygen comes? These are the things that is happening. The erythropoietin stimulates an increase in production of pro-erythroblast, and the erythroblast, there will be increased reticulocytes in the blood, and the reticulocytes will now increase oxygen carrying capacity of the blood and reverse tissue hypoxia, the original stimulus. That's the original stimulus. So when the tissue hypoxia is overcome, erythropoietin declines. That's when the tissues in the blood cells are not receiving enough oxygen. The body will now create a mechanism, something like a defense mechanism or protective mechanism, till when the person can get oxygen. For example, now when someone lacks oxygen and the person fainted, what happened when that person fainted? Erythropoietin will be stimulated because the person is just fainted, he's not dead. Erythropoietin will stimulate pro-erythrocyte, pro-erythroblast. The erythroblast will increase the number of reticulocytes into the blood, and when that is increased into blood, that one will now reverse the case. That one will now be working as a oxygen to the tissues, so that to keep that person alive. And it's for a moment. It's like a defense mechanism to the body for a certain time, for a moment, till help arrive to that person. Maybe someone fainted due to lack of oxygen, or and no one is there to help. These are the things that will be happening. So when help now come and they're trying to wake that person up, wake up, and it's because there is no oxygen. Maybe the person is being locked into a room. When they now open the door, they take the person out, rescue team, emergency team. They may give the person oxygen. If the person is still breathing, check if he's still breathing, give oxygen, all that will now reverse all these things that have happened. Will reverse it. Then when the tissue hypoxia is now overcome, that means when they now give the person oxygen, or maybe when they now rescue the person, when they open the door, they open the lock, they bring the person out, they bring the person to the hospital, they take the person to the hospital and all that, then the erythropoietin, the release of erythropoietin will now reduce, because there is now normal tissue hypoxia. There is now normal oxygen to the blood, to the normal tissue. But before that happens, there is a rescue team that will come up, and the rescue team is the erythropoietin here. And this erythropoietin is produced in the kidney. The erythropoietin will be there. It will not act. It will not be in action, because there's still normal blood flow, normal oxygen flow to the body and all that. But when something happens and a person cannot get oxygen, a blood cannot get oxygen from the lungs to the body tissues, immediately erythropoietin will swing into action. But once that person is being restored back, then erythropoietin production will be reduced. Erythropoietin will go back to its place into the kidney. Hope you understand. So when erythropoietin levels are low, red cell formation does not take place, even in the presence of hypoxia and anemia. That's the anemia, that is inability of the blood to carry adequate oxygen for body needs, develops. So when erythropoietin levels are low, red blood formation does not take place, even in the presence of hypoxia and anemia develops. So it is believed that erythropoietin regulates normal red cell replacements in the absence of hypoxia. That is, in the absence of hypoxia, the erythropoietin regulates normal red cell replacements. Hope you understand. So if you have any question, you can ask at the comment section. I will attend to it in my next slide, in my next video. This is the part 1 of blood, and there will be part 2 of blood cells. whereby I'm going to discuss about thrombocytes, which is the red blood, which is the platelets, and also the white blood cells. So I'm going to discuss about the eosinophil, the basophils. I'm going to discuss about that. So this is just on red blood cells, the erythrocyte, how it's being produced, how it works. And how it works is that it works with oxygen, and when there is no oxygen, what happened to erythrocyte, what replace it, that's the erythropoietin. And the erythropoietin replace it till the person gets safe, and when the person gets safe, then it go back to its normal, the erythropoietin go back to its normal production. It becomes low, whereas the hemoglobin with the red cells continue their normal functioning. So in our next slide, I'm going to continue from there, and I'll discuss about platelets and the white blood cells. Let me know if you have any question at the comment section, and I'm going to treat that or make a slide or lecture notes on it. Thank you for watching. Thank you for listening. God bless you all. Amen. From your lovely and dear nursing lecturer, Mrs. Fakonle, MA, or you can call me Nurse Taiwo. Thank you. God bless you.